Good morning. Thank you very much, Suzanne. It's great to be here in Texas, and of course, many of us traveled from New York here, and it's great to hear Suzanne slip in a y'all in her remarks a minute ago. A great story, Senator Whitmire, that I've heard Chief Justice or Presiding Judge Keller tell is about counsel making argument in front of her court, the Criminal Court of Appeals, and the attorney apparently kept addressing the court as you guys, and kept saying, well, when you guys ruled this in the past, and when you guys did this, and finally one of the justices apparently interrupted counsel and said, "Counselor, you will not address this court as you guys." And apparently the counselor, the attorney, said, "My apologies. When you all ruled this way the past year." And apparently one of the justices said, "Proceed." I know that really wouldn't work in New York or New Jersey, sort of where I'm from, but it does work in Texas, and it's great to have you all here. As has been mentioned, we're incredibly sensitive that any one of you could come up here and, in fact, is accustomed to actually giving these kinds of presentations, both in your state and nationally. And we recognize this is a lot of talking to that we're doing to you this morning. So I just really appreciate your patience. There's so many of our partners in the room, both in advocacy and national organizations and membership associations, going to be talking about the key role that you've played in this work too. So thanks for everybody's patience as we get through some foundational materials then that I think can really help inform the conversation throughout the next rest of the day and tomorrow. And I'm going to now see the same challenges I'm sure that Lori had with this. There we go. Okay. So what I want to talk a little bit about is this Closer to Home report that you've seen referenced, and I want you to listen to this not just with fascination about what Texas found, but what the implications are for your state. And I hope that many of you were able to pick up an infographic that is left out on the table when you walked in. This actually builds on a neat infographic that JPI and Mark Schindler and his team did a couple of years ago, showing the declines in the numbers of kids in confinement across the country. And I think a lot of people, this is familiar to you, but I think to many people it's less obvious. If you look at just these extraordinary declines that have happened in the numbers of kids confined, over 50% nationally, and literally just about every state experiencing a major change, right? This is not just a little bit of change, this is wholesale change in the approach that states are taking to incarceration. And again, familiar to you, but maybe not the national context, or certainly to a lot of your colleagues who don't work in juvenile justice every day. And again, as was referenced, Texas took a real deliberate effort to reducing the number of kids in confinement. Senator Whitmire can tell you about the horrific headlines that he was reading in 2007, where kids were suffering a number of abuses in facilities, and front page news coverage here, and legislature making it a top priority. And in 2007 took steps to say that you could not commit a youth to state confinement for a misdemeanor offense. State also taking steps to saying that the state could not continue to supervise people past the age of 19 instead of 21, so reducing the length of supervision that occurred. And then you see investments that were made in community-type supervision, also to try to reduce revocations to state-level facilities. And you can see here, each of these 2 years, the legislature meeting once every 2 years in Texas, significant declines in the number of kids confined, from about over 5,000 in the earlier part of the last decade to under 1,000 today, right? And that's a line that many of you could draw in your states across the country. Here are the recidivism rates that Texas was looking at. If you look at the turquoise bar there, that shows you rearrest rates for youth released from state secure facilities. Rearrest rates not much lower for kids under community supervision, right? These are high rearrest rates. And we know this is something that has been a source of frustration for everybody and something we want to do something about. Texas state leaders took the additional step then of basically saying, okay, we have fundamentally rewired our system. Now we want to take a look back and say, what impact did the reforms have? And it was formally commissioned by all 3 branches of government. It was done in support with great resources put on the table by the Annie Casey Foundation, Pew, and OJJDP. And we had terrific partnership with the Research Institute at Texas A&M and Director Riley and his research team at TJJD. And what they assembled, and this is kind of where the wonks in us kind of geek out, but other people sort of either glaze over, but it was an incredible data set. It was 1 million individual records that were assembled from across the state, so that they could literally track what had happened to those youth, not only in terms of contact with the juvenile justice system, but whether they were rearrested, and then follow them into adulthood. So it didn't say they didn't succeed if they just didn't come into contact with the juvenile justice system. It asked what happened when they were 18, 19, 20 years old in order to measure recidivism rates. And the first question that they were asking was, did things just naturally decline, or was this actually a result of the reforms? And what we were able to show, while we couldn't do a completely causal relationship, we did say that the juvenile arrest rate was declining before 2007 and your population stayed more or less level. It was really these sharp declines that occurred after a number of reforms that were implemented. The other question asked, as the population declined, did the disproportionality in our system change? The answer here is that indeed there were drops in the numbers of kids who were white, African American, and Latino, but those drops were proportional. So the racial disproportionality persisted, didn't get more acute, didn't get better, basically stayed the same. And then you can see here that while they significantly downsized their population, juvenile crime dropped, right? So we could show that, in fact, the state is able to significantly reduce its dependency on state confinement beds and at the same time see a significant decline in juvenile crime. Texas is, we can't say that these juvenile crime rates dropped because of the reforms. If we look at other big states like California and Florida, you'll see significant declines in juvenile crime there, and I'm sure you'll see those in your states too. Point being, it didn't unleash a crime wave, right? Dramatically reducing the number of kids in secure confinement. So here was the question that we were all dying to know, and advocates who have worked so much longer in this area than we have, support with the MacArthur Foundation and the Casey Foundation. Do kids do better when you keep them actually closer to home and not in a state secure facility? Now, it's a hard question to answer because a lot of people will say, well, the kid coming out of the state secure facility is a different kind of kid than the kid under community supervision, right? Well, Dr. Fabello and the research team at Texas A&M were able to control for all these variables. So they were actually able, with this huge data set, to basically construct nearly identical people and say this kid was put in a state facility, this kid, nearly identical characteristics, kept under community supervision. What was the difference? And what we found was that youth kept closer to home had a 20% less likelihood of being rearrested. So that youth did better closer to home. Furthermore, we knew that when that youth was rearrested, whether in the community, far less likely he or she would be rearrested for a felony offense. So those kids who were getting rearrested from the secure facilities more likely to be for a more serious offense. So on that finding, right, I think everybody can congratulate themselves. So many of you have really tried to reform your system on the hypothesis those kids would do better closer to home. Here you have unequivocal data really demonstrating that point from Texas that I think could apply to many of your states. The other thing that Texas did, which is pretty impressive, is it dramatically downsized the number of facilities that it had. It took a lot of those savings and it plowed them into the local community-based system. And you'll see here that if you just take raw dollars, the state doubled the per capita expenditure in youth under community supervision. So remember that question Suzanne just asked you, what if you doubled the level of investment, right? Texas actually doubled the level of investment in community supervision. Now this isn't adjusted for inflation dollars. If we adjust it, inflation adjusted dollars, it's about 60%. So if you take inflation adjusted dollars, you won't see the doubling, but it's still pretty close, right? A massive increase in funding for kids under community supervision. One of the things that we noticed is that as the number of kids in state secure facilities dropped, we saw about a leveling of the number of kids in county-based placement or in county-run secure beds. So one of the trends that we're seeing here is that although the state population is dropping significantly, some evidence that some of the dollars that the local governments are receiving from the state are being plowed into the operation of secure facilities at the county level. So that's sort of one interesting thing to note about the money. This was the sort of counterpart to the great news that we showed about kids doing better under community supervision. This question asked, are those kids being placed in different kinds of programs before the reforms doing better than the kids placed in these kinds of programs after the reforms, right? Let's compare the two. And you'll see there on the left side, of this graph, No. There you go. So this basically looks at kids coming out of state incarceration, right? That showed a 44% likelihood of a kid being rearrested. After the reforms, about a 41%. And you see all these different kinds of programs, from skill-based down to no intervention. And what you need to look at is compare the left column to the right column, and you don't see much change. So what we're showing here is that recidivism rates were about the same for kids in these different programs before the reforms and after the reforms, even though we were spending a lot more money investing in these programs. Perhaps the most sobering finding is at the bottom, those kids who were getting nothing at all doing as well as the kids who were placed in a program. In fact, some kids who were being placed in a program doing worse than those kids who were getting nothing at all. And keep in mind, this is controlling for all variables. So we're looking at nearly identical kids in each one of these kinds of programs, right? This was the more sobering, sort of disappointing finding that we had from the study. And we're going to talk to our panelists a little bit about some of the takeaways. But one of the things is that you are always sort of just amazed by in Texas is the variation across their state. And a great story, where are the Delawareans in the room? So great, I remember talking to the Delaware state legislator many years ago about the findings we had for statewide for Delaware. And he looked at me and said, you know, but are these findings from Delaware, Mike, not national data? And I said, yes, sir. I said, we have a study for Delaware specifically. And I was so proud of myself, you know, I wasn't going to say this is national data being extrapolated in Delaware. And he said, but did you look at North Delaware versus South Delaware? And I said, no, seriously, everybody in Delaware knows Delaware is two states. You got Northern Delaware and Southern Delaware. So if you're not from Delaware, who knew, right? If you are, this is common knowledge. And in Texas, what they'll tell you is there are 254 counties in Texas. And you have some incredibly rural spots, and then you have some of the largest cities in the country, as Senator Whitmire was mentioning earlier. They were able to break out findings per county across the state, and they were able to compare the different counties. Now, you can imagine going through this exercise in your state, right? Every county is going to tell you why they are far more different than another county, right? We serve a much tougher kid than that other place. You know, we have different resources than that other. Have you seen our gang problem locally, right? Everybody's got an issue as to why their community is actually far different from others. Dr. Fabello, and again, able to compare based on the kids that they were serving, what outcomes they expected for that county, and then say, this is what your actual recidivism rates were. And what he found were, if you see there at the top, there were a number of counties that had higher recidivism rates than were expected based on the kids that they were serving. And then there were counties that had lower recidivism rates than what was expecting. In other words, huge variation from one county to the next. And really interesting, and this, again, this is based on the kids that they are actually serving, right? Apples to apples comparison. Why is it that some counties are doing dramatically different than others? Well, one thing we found when we looked is that some of those counties that actually had higher than expected recidivism rates were using a lot of their dollars to actually focus on low-risk kids. They were actually plowing their resources into serving kids who are at lower risk of reoffense. And you'll hear more about the research about how that can actually introduce kids to higher risk kids, and they pick up their bad habits, can result in more intensive supervision and actually worsen outcomes for them. You'll see here also that while lots of low-risk kids getting programs in Texas, we also showed here that kids were actually, who had acute substance abuse needs, not getting placed in programs. So we had kids low-risk, no substance abuse need, getting put in a drug treatment program. And we can imagine a prosecutor and a judge, for example, agreeing, this kid was caught with, you know, heroin in the car, must need a drug treatment program, right? In fact, you know, we found here that there were kids who didn't need drug treatment getting in those programs, and kids who needed it not getting into those programs. So what were the key takeaways for Texas? Number one, they reduced the number of youth incarcerated in their state-run secure facilities without compromising public safety. Number two, those kids who were closer to home have lower rearrest rates than similar youth released from state-run secure facilities. Number three, they invested some of the hundreds of millions of dollars saved, which resulted from the closure of facilities, in community-based supervision and services. Number four, recidivism rates for youth under community supervision, despite this increased investment, haven't necessarily improved statewide. This was the findings that was taken to them in January of 2015. Chief Justice Hecht, Senator Whitmire hosting a big forum in the Supreme Court to review the findings, and Senator Whitmire shepherding legislation, which we'll talk about in a little bit, addressing a number of the findings. And I won't steal his thunder, I'll let him talk a little bit about what SB 1630. I love how each of your states, just the numbers roll off the tongue with a particular bill, but for those of us out of the state, we don't know what you're talking about. Here you'll hear them talking about SB 1630, trying to reduce the number of kids further who are in secure confinement, and then trying to help improve outcomes for kids under county supervision. here are the questions we think you should be asking, right, based on what we found in Texas. What data exists in your state explaining why the number of youth incarcerated has declined? Our experience has been that some of the best data in the country exists right here in Texas. A lot of your other states challenged to do studies of similar rigor that have been done in Texas. Number two, what services, supports, and supervision are provided to youth closer to home? We hear a lot about, well, we're keeping them closer to home. What are they getting? What exactly are those kids now getting that they are closer to home? And then number three, what difference is it making? You're doing more to help serve those kids closer to home. Are they, in fact, less likely to recidivate? And are there differences from one county to the next? And if so, why? These are the questions that we think now you want to be asking at this forum. Many of you are already starting to ask it. And looking forward to having the discussion with you over later today and tomorrow. So there we have it, kind of a framing case study, right, from Texas. And now we're going to talk a little bit to our panel about what they did when this data was presented to them in January. And I want to start with Senator Whitmire. Senator, a little bit about, I mean, that's a lot of information to run through lawmakers who aren't necessarily that familiar with this kind of issue, have a lot of different priorities. How did you translate to them some of the key takeaways from this? Well,
obviously, in each of your jurisdiction, you're going to need a spokesman or an advocate in the legislature, and you won't always have that, but I would develop one if you do not, because I could spend the rest of the morning talking about how many legislators, state reps and senators and administrators in the governor's office just don't understand criminal justice, particularly the complexities of juvenile justice. I mean, you know, I've actually sat by a chairman of finance, and we get to talking about some treatment programs for an adult or juvenile system, and he would interchange probation and parole. No. So at the end, this is a Naval Academy graduate, and at the end of that session, I said, Steve, if you're going to talk about funding these programs, you've got to know probation's on the front end, parole's at the back end. He said, well, Whitmire, if you keep calling me stupid, you're not going to get your money. But that is a pretty real example. First of all, you have to put a face on who you're dealing with. You know, many of my colleagues don't know, when I go down to the juvenile probation department in Harris County, and I asked David Brooks, I said, who's your youngest client today? Oh, it's a young lady, 12, that kicked a teacher, broke her leg. I said, I'd like to meet her. So I go visit with her, and while I'm kind of finding out her difficulties, they call her name to the front door, to the cell block. And they said, no, you don't have to leave. I said, what was that about? Oh, it's time for my birth control pill, my birth control shot. Okay, I know I'm talking to people that witness this, but the legislators don't witness this. They don't know the complexities of your population. You know, I asked him the other day, who's your toughest client? I got a 14-year-old Whitmire that's bipolar, and we don't know what to do. He just wants to fight. So that gets you really serious about what we're talking about today. It's a very complex issue, and so you can't just say closer to home, because most of the legislators will think, oh, Whitmire, you just being soft. You want them with their parents. No, most of these kids don't have parents like you and I had. Closer to home means a delivery of services. And it's just irrefutable, certainly in the state of Texas, if you're in the major urban areas, Houston with its medical center, its educational system, and I will emphasize mental health till I pass out, because if we can get some mental health services. My daughter taught the second grade in Houston for a couple of years. She said, Dad, this young man at 10 o'clock gets on the top of the slide and dares anyone else to come up there, or he'll shove them down, coming from a homeless shelter. We've got to deal with early intervention, certainly education. The second grader that wants to push everybody off the slide, no one's helping him in most jurisdictions. But back to closer to home. Like so many states, we were dealing, and still I'm frustrated that we've got a couple of rural locations. If you take an inner city African-American young teenager from Houston and send him to West Texas, where he will never see anyone that will mentor him, that looks like him, understands his challenges. If you have a language barrier like so much of Texas with Spanish-speaking young people, the first language, and send them where there is no such experience and then send them back to Houston, why are we surprised with the failure? So it's not that you want to be nice to these youth, which is okay, but you're trying to get, it's the outcome you're looking for. And if you're going to send them to rural Texas, we had 12 in '07, now we're down to 5 with 1,000 kids. We did have 5,000. It's what they experience. It's the professional help they get. It's the mentoring. It's the end result. Obviously, let me stop right there as I touched on a moment ago. The real goal is not to be there in the first place. So if we give the locals some resources, and one of the things that we were successful with, we made a pledge that the money will follow the kids if you keep them in your community. Don't wait till they become a felon and then they are sent off still to the 5 state facilities, which I will digress and say I think we will always need a lockup for violent, disruptive youth at the state level. We're at 1,000 now in the state. I hope and pray we can get down to about 500, but there's going to probably always need a place for some violent, disorderly, dangerous kids. And let me just suggest, if you don't talk about them, you won't get the legislature or their constituents to follow you. You have to be tough, and there are some tragedies that have to be dealt with. And Travis County sends no one to the state with the exception of 1 or 2 particularly violent youth that I think you will always have to confine. But at the end of the day, early intervention, going back to education, do you know what? If we just could have resources and eliminate dyslexia. Have you ever visited an adult prison or a juvenile lockup and see how many just can't read and write? It begins there. So deal with them when they're misdemeanors, deal with them when they won't come to school, and that's how you get the legislature to follow your lead, because you make a promise to them and you can prove it. You either pay now or you're going to pay later.
Thanks.
It's more affordable to do it earlier, and also you'll have fewer victims, which they want to know how this all addresses public safety.
Thank you, Senator. You can imagine me in the uncomfortable situation of asking the transition from the Dean of the Senate and the Chairman, who's been a fantastic champion of this, now to our juvenile justice leaders at the state and local level. First, I want to turn to the head of the state juvenile justice system, the Texas Juvenile Justice Department, David Riley. Director Riley, could you talk a little bit about one of the things Senator Whitmire did in this legislation, and Senator Whitmire will come back to you about this in a little bit, but a lot of counties saying, give us more resources, but no mandates, right? So in other words, we need state resources, but we don't necessarily want to be told how to do this. And yet you're seeing data from this report that's actually showing mixing of kids of risk levels, kids who don't need drug treatment getting it, kids who do need drug treatment not getting it. How do you really make sure there's accountability with those state dollars while making sure that you're still working in partnership with local government?
I think, Mike, there are several fronts that have to be addressed to address that. The Closer to Home report did validate for us that the state is going in the right direction, and it confirmed that we need to redouble our efforts in some way. A key finding in the report, aside from the recidivism numbers that you saw, is that Texas can and really must do a much better job of matching needs to services. And that's a critical area for us in the Texas system, from when a kid first hits the front door to when they exit our programs and get off parole. So that's a major emphasis for us that we have already begun to work on. In fact, Texas has 3 approved different risk assessment tools in use today. We've been encouraged by the report. The report recommended to us that we reconsider that and reconsider going to one tool, which we are in the process of doing. We expect the Juvenile Justice Advisory Council that is appointed by our governing board to make a recommendation to the board this week that we do go to one. But it isn't just using one tool, it's how you use that tool and how well it's integrated into case plans and to services that you provide. How are you using it to identify the most critical needs a young person has and making sure that your services address those needs first. So that's a huge area for us and one that we are going to be spending quite a bit of time on in the coming years. Senator mentioned that how important it is to have an advocate in the legislature and your state legislators for you for the progress of the juvenile justice system, and that's been we've been very fortunate here in Texas to have an advocate that has been part of this reform effort for the past 8 or 10 years that I've been familiar with it anyway. And so we're also very fortunate in Texas to have a governor who has made the safety and protection of children a major part of his administration. All those things make a huge difference when you are trying to pursue legislation and resource development to address the needs. I want to talk a little bit about regionalization, Mike, if I can. Senate Bill 1630 is really, we have seen that as the next logical step in the reform efforts in Texas. And basically what this directs us to do is to make maximum use of existing resources that exist throughout the state at the county level. We know now today, for example, that of the kids who get committed to the state, about 20% of those kids, when they receive IS last year, for example, 20%, it's about 160 kids or so, when they were assessed at our orientation center, they were determined not to need secure facility placement. So 20% of those kids were redirected immediately from the orientation and assessment operation directly to medium secure facility and successfully stayed out of our secure environments. So we believe that the next logical level in reform is to identify those kids, help the counties develop the services and resources that they need through the funding that this bill has provided, and enable those kids to stay closer to home by encouraging counties to make use of other county programs and facilities close to their jurisdiction. Some of that has gone on for years, but this will enable us to really expand that so that these kids can be managed closer to home.
So I'm going to switch gears in a minute to our local probation chief in just a minute, Chief Smith. But let me just sort of point out that one of the things here that's really interesting that the state's talking about is what kind of technical assistance can we provide local governments across the state to help train them, if I understand this correctly, Director Riley, you, Senator Whitmire, talking about. What can we do to help align you with some of the best practices? Because, you know, clearly it's not just enough just to say this is something you need to do. We actually need to provide the training and technical assistance to counties across the state.
Could I interject one thing which I'm certain most states will experience? It's great for Houston or Dallas to be keeping people closer to home. What do you do in small rural communities? So the legislation anticipated that, and it allows, and in fact, it kind of encourages the PACs, Southeast Texas Coalition, intergovernmental agreements, to allow smaller jurisdictions to come together and form their own programs and or work with the urban areas. But, you know, with the size of Texas, it's great to say stay at home and you've only got a community of 200 people. You know, what do you do? So that's a key component that the Juvenile Justice Department will help facilitate the coming together of smaller communities to share their resources.
There's 7, as the Senator mentioned, there's 7 what we call regional chiefs associations in Texas, but the state is divided up into 7 geographical areas. And we are looking at developing resources specific to the needs of those geographical areas and providing the funds that they need to provide the kind of services that will prevent kids, that will give courts, local juvenile courts, more options when they're considering commitment.
Thanks, Director. Dr. Terry Smith is the head of the Dallas probation system, and in Texas, like California and other places, the chief probation officer, a key focal point for administering the local juvenile justice system. Dr. Smith, when we looked at some of the data, we found that Dallas actually did better than what was expected in terms of its recidivism rates. What do you think was going on that really enabled you to do better than what we thought you would get in terms of recidivism rates?
Thank you. We have a system, I think, in Dallas that mirrors other counties, other states. One of the things that happened with Dallas County started a long time ago because change doesn't occur overnight. Systems don't change overnight. So one of the things that helped our partnership was our transparency here, was our partnership and collaboration with the Annie Casey Foundation and JDAI, who has 8 core strategies, which we looked at. 8 core strategies should be for everybody. What do you want to keep kids out of the system? How do you divert them from front end? You heard Ms. Garduca talk about those. Those also with the MacArthur Foundation kind of mirror that too. What do you do to keep kids out of the system? A front end assessment that is supposed to help keep those kids out of the system. What do you do? Part of what we've heard a lot of people talk up here. You heard Mr. Listenby listen, OJJDP, the MacArthur Foundation, the Annie Casey Foundation. Nobody wanted, when they said they were coming into our house, meaning all the state of Texas, to look at us and say, what are you guys doing well? What are you guys not doing well? You have to take that hard look at your system, and we have a variety of partnerships that can help you do that, and also help you have those tough conversations with your district attorney's office, with your district judges, with the public defenders, with the police department, with the school system. So all of those have to take place, those difficult conversations. And if we don't have those, because I've listened to some people say, it's easy for you to say you have a buy-in from all of those people, but what do you do if you have a district judge who just doesn't care and arbitrarily just wants to submit them to wherever they want to go? Well, that's where you use your partnership. That's where you use your data to show where the breakdown is and what that is. So no matter where we fell on that spectrum in terms of if we did better than expected, as expected, or not as well as expected, it's a jumping board that you have to look at what you have. Front end, we have to talk about, some disagree for whatever reason or agree on diversion courts. But if you don't give your judges options on what to do with the kids that we have in our system, then they're only going to use what's available. It's either probation, state facility, or you divert them. Well, you have to have something in the interim. And Senator Whitmire mentioned it, progressive sanctions. You don't put a 12-year-old who's shoplifting or a 13-year-old who's shoplifting, you don't lock them up because the parents say, I don't know what to do with them. Secure facility is not to lock up kids because parents have lost control of their kids. You know, I talk a lot about, Frederick Douglass says this, it is easier to build strong children than to repair broken men. And that's what we have to focus on. Our system consists of kids who are overrepresented in our community, whether you're from South Dakota and that looks like Native Americans, or whether you're from Texas, it looks like black and brown kids. We have to address that dichotomy of how do we fix that system. Texas invents words. You heard the term affluenza that came out of Fort Worth. And that basically explains the ability to have resources. Well, the kids we deal with who are underrepresented in their community, overrepresented in our system, they're guilty of, another Texas term, poverty-itis, meaning they have lack of resources. So when you have that in place, it is incumbent upon all of us. Of course, it always helps when we have great leadership like Senator Whitmire, Senator Royce West, we have David Riley, we have chair of the TJJD board, Mr. Fisher. We can name a lot of people who are very invested in doing that. So that always helps. So no matter where we fall, we still always have to have difficult discussions. If we're not looking at what our data has, what it shows us, then we're missing an opportunity to make changes in that system. So that's what we, and a lot of counties in Dallas and a lot of counties around the state of Texas are doing to make sure that we address the front end, we address the back end. And then in the middle, our counts have gone down, so what can we do differently? What are we looking at? We have visionaries with TJJD, with Senator Whitmire. All of these are pieces of the puzzle. So I'm not going to say necessarily that Dallas is any better than any other county who has the buy-in from that complete puzzle, from the top to the bottom. I always like to say from janitor to judge. You just have to have that buy-in from everyone, and we have that perfect storm where they are buying into what's best for juveniles.
Thanks, Chief. Senator, I'm going to give you the last word here. I'm going to ask our next panelists to start making their way to the front, if you don't mind. But Senator, I think one of the things that's so interesting that so many states don't have is you actually have now county by county recidivism rates. And the state's basically signaling, we're going to hold you accountable. Now, a lot of the counties, right, would say, hey, even though you're giving us money, most of the money still comes from local government. So, 80% of the funding in some of these larger jurisdictions still coming from local government. Just talk us through, and knowing you've got so many elected officials in the room who are always dealing with that push-pull of mandates / support, and it's in the eye of the beholder there with local governments. What strategies are you recommending so that you can really kind of help advance local governments while at the same time making sure there's accountability there?
Well, obviously, the concept of paying now or paying later, and not only in dollars, but you're going to pay later in another crime victim if you don't fix these youth problems. And let me emphasize, you cannot, so many members of the legislature and their constituents, make it sound like that you're not being firm, and I'll even use the word tough, on these youth that they read and see in their community. But what you have to emphasize is the toughest thing you can do to a youth or an adult, quite frankly, is fix their problem. I had a judge one time convince me in the early 90s, and I've used his knowledge. He said, Whitmire, the easiest thing I can do is send someone to jail or prison. And you can say the same for juvenile justice. That's the easiest thing allowed. But fixing their problem, dealing with their mental health, their education level, and their job skills is much tougher in the long run. Making them be a responsible person can be sometimes tougher than just giving them a place to stay. Now, let me touch on one other thing that hasn't been mentioned. How do you do it politically? It's tough. It's real tough. I understand the economic impact of a facility in a rural area that you might not need again. And I've gotten a lot more wise in the last few years. We've shut down, we went from 12 down to 5, and I've had county judges and mayors threaten me, and it's so tough on your colleagues because in a rural area, that is the economy in some of these towns. Obviously, now I don't talk about shutting them down. We're just going to reallocate the youth to local, regional sites. Those existing locations can be gradually decreased in size and scope, but I understand. What you do, you overwhelm them with the facts. You show them the money saved. Hopefully that'll appeal, but really it's the outcome that just is overwhelming. You get in the finance committee and you get the stakeholders to come in and talk about how much better job that, in Houston, Harris County, or in these regions, you can get a psychological nurse, you get professional help, you get near a university that can save some of these youth. But I understand the difficulties in the politics of relocating. And the only way you're going to deal with that is talk about the dollars and the outcomes on recidivism. So it's not, at the end of the day, it's complex, but really at the end of the day, it's not that darn difficult. And someone said, how do you do it? You just keep saying it, and finally they'll say, hell, let Whitmire try what he wants to do, okay? So sometimes it just gets down, you just got to say it enough times that they start believing you, and they'll let you try it, and it will work. I'm just here to tell you what we've done in Texas, and there's another thing is don't worry about who gets credit for it. Major factor. Spread and allow some of the colleagues that aren't out front as I am, let them take credit for it in their community and at the state level.
Terrific. Well, please, you can see, I'm going to give credit to these three terrific folks who've been instrumental in helping achieve a major amount of reform.